Uncertainty about the health of a loved one can make us feel very anxious or worried or out of control. And even minor symptoms at this time could be a signal that something serious is going on. And so as much as possible, we want to have accurate information to act on. Not be caught up in worries about what could happen, but focus on what we know to be true. So there's an online tool you can use at the Alberta Health Services website that can help you evaluate whether you need to be tested for COVID or not. It's understandable with all the messaging out there in the media that even minor symptoms are things that you might be more worried about than at other times. We want to keep in mind though that most illnesses still are minor illnesses. So there's still colds going around, flus going around, and worrying about it can make it seem worse than it actually is. So seek out good information, seek good sources of information, and look for places you can trust. So the symptoms that you're experiencing plus the isolation measures could make you feel more anxious, more isolated, more lonely. These are real feelings, and so pretending they're not there isn't going to make them go away. Instead, I'd say reaching out to people you trust, people you can talk to about how you're feeling, trying to engage in healthy coping strategies to manage those feelings is going to be a lot more effective way of dealing with it. Whenever it comes to talking to children, the most important thing is first identifying what they understand or what they're scared of. Oftentimes as adults we can assume things that our children might be thinking or feeling, but checking in with them first and then responding to what they're actually dealing with is going to be a lot more effective.
Together, we do amazing things every day.